In a nutshell, Ochsner says we can mandate our employees be vaccinated, and Jimmy Faircloth, representing a whole bunch of unvaccinated employees, says no, you can't. Is that basically it? Is that what the fight's about?
Yeah, that's really what the fight's about. It's about whether or not we have a fundamental right to refuse medical treatment, and I think we clearly do.
How many workers, Jimmy, are involved? Is it a whole host of folks?
It's a whole host of folks statewide. It's really remarkable. I originally filed the suit with a couple hundred healthcare providers down in the Acadiana area who were interested, and we filed a couple claims there that are being litigated now to the Court of Appeal. And we yesterday filed in Shreveport and in Washita, in Monroe Parish, in Monroe. And right now the suits are only involved healthcare workers, but I've literally received hundreds of emails and calls from employees in every imaginable sector. I received a call the other day from an engineer offshore on a platform, one of the major oil companies, sending me an email saying, we got workers out here who don't want to do this. It's really an extraordinary phenomena to watch what are really non-political employees, non-political people saying, wait a minute, this is an important big issue, and I see there's some attention to it, and I don't want to do this. And there's an incredible pushback coming. It really is.
I don't know if at this point you've spoken to Ochsner folks at all, be it their attorneys, be it anybody else. I'm just looking at this and I'm thinking, no, there's no way this gets settled ahead of time. This is probably going to go all the way, isn't it? It has to, doesn't it?
Yeah, I think it probably does. I think it's unfortunate. I would love to see these companies say, wait a minute, the numbers are changing, the virus is waning, the vaccine efficacy doesn't seem to be as strong as you originally thought it was. Let's pull back on this policy or extend the deadline and give everybody a chance to take a breath and see where this goes. I think that makes eminent sense. But I don't think that's going to happen. I think these decisions were made months ago. I think they're detached from the moving science. And unfortunately, I think corporate dictates have taken over and are ruling common sense at the moment. I really do. There's no reason. And you think about what they did in terms of the threat to charge spouses, unvaccinated spouses. I mean, that is so draconian. That is so unnecessary to float that now. It is pure coercion. When they did that, it signaled a pretty stubborn commitment of, by goodness, we're going to force people to do this, no matter what.
You said something really interesting, two things really a second or two ago. You said, I think, in reference to Ochsner, you said, I think this decision was made months ago. And then you said that it's not the medical people who are in charge of making these decisions. Did I get both of those points?
Yeah, these are corporate decisions. I mean, the medical people are in an enormous state of conflict over this. These are corporate decisions that are being made. These are board-level decisions that are being made. It is, in the healthcare capacity, they understand the dynamic of the decision. They're actually the best informed people to understand this is wrong because they live in the world of informed consent. Everybody that goes into a hospital has to sign informed consent forms. They know that's the law. Lots of employers are reading media accounts and they're thinking, hey, we're supposed to do this, so I'm going to do it. I'm scared. And there's a good faith effort to try to participate in something that they think is positive, and they're just misinformed. So there's kind of two different levels to this. But the decisions themselves are being driven at the managerial level, not at the healthcare level, not anymore.
Is it accurate, though, to say that your lawsuit in the Lafayette area in Acadiana, you lost round one, and now you're appealing? Is that true?
And how's this different?
No, that is not. That's partly true. Actually, I think we won round one because here's what happened. Two different cases filed in the 15th JDC in the same Lafayette court. One judge says no cause of action because these are private employees. He basically concludes that private employees don't have the same fundamental rights as public employees, which I think is absurd. I do. I think it's wrong as a matter of law, and I think it will be reversed. The following week, a different judge in Lafayette says, I think you do have fundamental rights. I think they do apply to everybody, but I don't think we have any harm yet because nobody's been fired and no exemptions have been denied. So I'm going to dismiss the case without prejudice, and you come back to my courtroom if your rights are offended. That's two very different outcomes.
Are people now being fired? We were told October 1st was going to be, if you're not done by October 1st, you're going to lose your job. Is that happening?
Yeah, I'm not aware of any of our plaintiffs that have been terminated in the lawsuit. There are people around the state who are being fired. We are getting calls daily of people who they're starting to poll employees and say, tell us what you intend to do. And then they're making decisions based on if people say, I'm not going to get the vaccine, well, they're starting to make these preemptive decisions, and some of those involve laying off workers. So, yeah, there are people around the state being fired because they've stated their intention not to do the vaccine.
Is it more about freedom rather than the vaccine?
Oh, there's no question. Aaron, that's exactly what this is about. And we have been so clear over and over, this is not an anti-vax litigation. That's not what this is. This is about who makes the decision over what you put in your body. I mean, this is so fundamental. It's so important. As a matter of fact, we've got a couple of the plaintiffs in the healthcare suits who actually have been vaccinated. And we've got others who are saying, I might do it. I'm just not going to be leveraged into doing it by my employer.
Does it behoove Ochsner, or for that matter, any other employer who has Vaxx mandated their employees, does it behoove Ochsner in this case to stall, to drag it out, to make it take as long as they can, because then they can implement whatever it was they wanted to implement?
Yeah, I think there is a stall going on, but it doesn't have anything to do with the disease process. I think the stall has to do with the federal process. I think that there's probably I hope by the employers who are doing this that the federal government's going to swoop in, issue a rule, try to federalize this issue, and then it'll get tangled up in the federal courts, and the state litigation will be stalled. I think there is a stall, and there is a delay that's going on, and I think it's waiting for the federal government to kind of save them from the issue, regardless of how it turns out.